Okay, so another question is from somebody who had uterine papillary serous carcinoma, and this woman found out that she also had Lynch syndrome. So that's what we were talking about with the microsatellite or mismatch repair instability, mismatch repair deficiency, or what we call microsatellite instability, that goes along with this Lynch syndrome. She states, this puts me at higher risk than the normal population for colon cancer. What's the best thing I can do to improve my chances of not getting colon cancer or catching it early? So the thing about Lynch syndrome is that colon cancer is the most common cancer, and uterine cancer is the second most common cancer, but there is a slightly higher risk of other cancers as well, including pancreatic cancer. So it's good to see somebody who knows about this and understands the best recommendations for screening tests to help detect cancer in high-risk populations. Many of the major academic medical centers today have high-risk cancer clinics where people who are really very versed in this particular situation will deal with people who are at high risk and have a genetic syndrome. In terms of colon cancer, the best thing to do in that situation is to have colonoscopy at a regular interval. Again, we know that if we find a polyp that is happening in the colon before it becomes malignant and it's still benign, then you never get cancer, and that most of the time colon cancer does not happen without going through this polyp stage. So I would say that the most reasonable thing to do would be to get yearly colonoscopies for a couple of years, and then maybe go out to 2 to 3 year intervals between colonoscopies. But because of the need to screen for other cancers as well, where the screening is not as clear, it would be good to be seen by a specialist in high-risk cancer prevention.